We understand that women smallholder farmers, those who keep chicken, those who keep goats, really play an important part in society.
Access to veterinary services is important in Karamoja and other cattle corridors. Livestock is a primary source of livelihood. Gender is often overlooked in animal health programs. However, given the socio-cultural intricacies of Karamoja, ignoring these factors may hinder animal vaccination.
Why are we talking about the livestock vaccine value chain? In our experience, when we first came to Uganda, we met women in the communities whose animals were dying of PPR. PPR is a goat disease. We also met many families whose animals were dying of Newcastle disease. Newcastle disease comes, it sweeps through the community. People think that's normal. They lose their animals and then they start keeping animals again.
Now, Canada International Development Research Centre, Global Affairs Canada, and Bill and Melinda Gates Foundation has supported the development of affordable livestock vaccines targeting diseases that impact women and men, livestock keepers, and facilitates their access and use at scale.
And specifically in the Karamoja context, we wanted to look at women from different ethnic groups. So our research questions, our main research questions were how gender intersect with ethnicity and what kind of barriers this intersection creates to women's access to vaccines or vaccination activities and the participation.
The project assesses the state of women's empowerment and gender parity on the vaccine value chain, identify the key entry points along women stakeholder farmers and entrepreneurs. A BIM woman member of parliament and chairperson agriculture committee in parliament, Janet Akech Okolimoy, says the intervention to support women in livestock is timely.
Many livestock value chains, right from production up to the end point of sale of the product, quite often leave out women and other vulnerable groups. So I am happy that your research and project targets exactly these marginalized and vulnerable groups.
Professor Anthony Mugisha from the College of Veterinary Medicine, Makerere University, is the co-principal investigator of the project.
A lot of hope if our findings are implemented, because one, the issue of using the people in the community to be fully engaged, not outsiders, but fully engaged, especially in the area of poultry and goats, which has been marginalized. There is a lot of hope. I wish I could convince the government, but this one could be a big component in the parish development model.
The livestock vaccine value chain, women and other marginalized groups like minority ethnic groups, the elderly and disabled have less access to vaccines as well as limited ability to influence decision-making on vaccination and animal health within the households. Joseph Bule reporting.